Strangles, or infections that are caused by Streptococcus equi, subspecies equi, are very common occurrence in equine veterinary practice. The role of antimicrobials in treating strep equi infections has been controversial for a long time, but it's important to remember that most cases of strangles in equine patients resolve spontaneously in uncomplicated fashion and require no antimicrobial therapy. Certainly, we wouldn't withhold those drugs in cases of complicated strangles, such as metastatic abscessation or pneumonia or something of that nature, but the vast majority of cases don't require antimicrobial therapy. It's a common consideration. Clients often ask for it, but it's important to consider the pros and cons of administering these drugs or not administering these drugs. For example, if antimicrobial therapy that's appropriate for the organism is administered prior to development of lymph node abscessation in the head and neck, it is certainly possible that that infection may be resolved without complication. However, the immune response to that infection may be inadequate for protecting the horse against subsequent exposures, which if the horse is standing on a farm that has an outbreak, is likely to happen. The other consideration is, should we administer antimicrobials after development of abscessation in the head and neck? And almost universally, the party line answer to that is going to be no, because unless the course of antimicrobial therapy is very prolonged, it's unlikely to completely resolve this infection, meaning it's likely to recrudesce, come back as soon as those drugs are discontinued. And so, treating horses with strep equi infections with antimicrobials is usually not necessary and should be reserved for cases that are complicated. When considering antimicrobial choices for treating a complicated infection with strep equi, beta-lactams are always going to be a good choice. Streptococcus equi, subspecies equi, is universally susceptible to beta-lactams. Therefore, penicillin is a very appropriate choice for treating strep equi infections. This is also a reason why you might not see an antimicrobial susceptibility from the diagnostic lab after submitting samples from a suspect patient because of this universal susceptibility. Best practices in infection control when managing a very contagious bacterial disease like Streptococcus equi involve regular taking of body temperature, isolating animals that might be infected within an outbreak, and segregating them from horses that have no clinical signs of disease. Biosecurity is the most important part of managing a Streptococcus equi outbreak on any given farm and preventing it from making its way to other farms. And so, in lieu of relying on antimicrobials to control these problems, biosecurity is the most important component of any management scheme on a farm that has a strep equi outbreak. And with your help, we can help keep antimicrobials useful for animals and humans.